Today I'm going to be talking about dye and fluoride and how they relate to dental caries. Dental caries are the signs and symptoms of an oral disease where there is localized destruction of the tooth. This may present as a non-cavitated lesion or a cavitated lesion. Non-cavitated lesions or white spot lesions will usually look like a white chalky area on the tooth, whereas the more progressed cavitated lesions look like a black or brown hole in the tooth. As you can see here in this picture, the white areas here are the white spot lesions, and the reason why they're located near the gum line is because plaque likes to accumulate in these areas. In this next picture, you can see these black or brownish areas here, and these are the cavitated lesions located on the chewing surfaces of these teeth. So how do caries lesions form? There are many factors that increase or decrease the risk for dental caries, such as salivary flow, education, and social factors, but today I will just be talking about diet, the dental biofilm, and fluoride. The plaque biofilm is a massive bacteria which grows on oral surfaces. It has often been described as having a furry or rough texture that can be felt on the tooth surface. It forms by bacteria initially sticking onto a protein film called a pellicle, and then they grow in number and develop a protective coating which is resistant to antibiotics and antimicrobials. They then mature, increasing in the number of harmful bacteria and decreasing in the number of good bacteria and spreading to other areas in the mouth. As you can see in this diagram, they are adhering to the protein pellicle here, increasing in number or proliferating, and here they are developing a dental biofilm which is resistant to antimicrobials and antibiotics. And here they are spreading to other areas of the mouth and repeating the process again. The bacteria use fermentable carbohydrates as energy and produce acid as a product so that the pH, which is a measure of acidity, decreases in the mouth. When the pH decreases past a certain point, the tooth structure begins to dissolve, and this is called demineralization, and a carious lesion will eventually form. Because bacteria in the biofilm require certain fermentable carbohydrates to live, when you eat food high in those carbohydrates, especially simple sugars, bacteria can quickly access those sugars. Despite what many people believe, lollies and cakes and fast food are not the only things that can cause cavities in your teeth. Fruit and also fruit juice can do the exact same thing. When the bacteria metabolize these sugars, it causes a large pH drop in the mouth because they produce acid as a product. The more often and the larger the quantity of these foods that you eat, the more often you will experience a drop in pH in your mouth, and it doesn't have time to return to the normal pH, and your teeth are more likely to begin to demineralize and carious lesions to form. As you can see here in this graph, these red areas here are when the pH has dropped below the normal pH, and this is when the enamel has time to demineralize and dissolve. Fluoride plays an important role in the protection of dental caries. This is why some countries' water supply is fluoridated, especially here in Australia where about 80% of the population drinks fluoridated water. When the tooth is exposed to fluoride, it can take it in and become stronger and more resistant to demineralization as it dissolves at a higher pH, and so it is less likely to form a lesion. Fluoride also plays a role in remineralizing tooth structure that has already been affected and so reverse the disease process. However, this is only really effective for earlier stages, so action should be taken to reverse the process as soon as possible. Signs that white lesions have remineralized are that they are no longer chalky but hard, shiny, and often have a brown appearance. As can be seen here, this is brown and shiny as opposed to the picture that I showed you earlier where it was chalky and white.